Dennis J. Courtney, M.D., Director of the Courtney Medical Group, located at 3075 Washington Road, Big Rose, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, M.D.
Good morning, everybody. Good morning, everybody, and welcome to AM Impact on Your Health. AM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. AM Impact on Your Health, heard every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, and fascinating health topics, and where we do encourage you to call in to join in. Now here we are today on a Friday version of the show. It's usually a little more exciting on a Friday. We call it the Get 'em Up Out of Town version of the show because each and every Friday we try to get you ready to have a great launch to a wonderful weekend. We hope we're going to be able to do the same today. We're going to let you set the tone for today. I have a lot of things on my plate, a lot of messages, a lot of things that happening that I'll bring you up to date on. But of course, at any point, if you want to call up and dial us up and ask a question or make a comment, we're going to open them up when I hear that knock on the door. The number to get in on this, if you'd like to get some, is 412-825-6262. That's 412-825-6262. We open it up for phones today. Now, looking at some calendar issues, in keeping with always thanking the guests from our previous show, I hope you did enjoy it. Well, I gathered you did enjoy it. In fact, you had quite a bit of things on your mind. You started calling us up at a great clip. I'm talking about our guest, Eric Shapira, who was talking about issues of aging, a gerontologist himself. Wrote a book. He did send me a copy of that book. I've been going through it. It's a fascinating read. And letting you all know, we're bringing him back on Monday. So Monday morning, we're going to be talking about other aspects of this aging concern for all the wee baby boomers hitting these issues right now. He calls us the members of the sandwich generation. We're sandwiched in between our parents, still alive, and our children, absolutely alive, and we're sandwiched in between. Well, this sandwich generation has a lot of questions. They're not going into this area of their lives, let's say, skipping and whistling a tune. They are kicking and screaming and crawling and gnashing at the walls here, but there are issues that you have to confront. And so we learned that you had quite a bit of interest in it. I'll be bringing Dr. Eric Shapira back on Monday. More to tell you, of course, but I do hear a knock at the door. Why don't you come on in the store? Hello. Welcome aboard.
Yes, doctor. I have a relative that's in the hospital, has a blood clot in the lung.
Pulmonary embolism.
Yes. What type of a blood clot buster do they have that could be used to break that up?
Well, let's just say the standard treatment, and pulmonary embolisms, by the way, very dangerous. I'm glad to hear that your relative made it through the initial onset, because so oftentimes the event itself, the actual clotting, is such a dramatic episode that it is life-ending. And so first hurdle is over. The clot is not as large as it could have been. And so the forecast is that your relative is ultimately going to be okay, or aren't we there yet?
Well, they have her on oxygen. They put a tube down her throat, I guess into her lungs for oxygen.
Yeah, they have to ventilate her. Look, what happens, of course, is that the blood enters to the heart through the right side of the heart, and it's coming from all over the place, but particularly the distal extremities, and in this case, more than likely, the lower legs. And down the lower legs, things get some sluggish movement. The circulation, especially as we age, diminishes. And blood, in some individuals that have a proclivity to clot, does just that forms a rather lengthy clot. I mean, sometimes these clots can be 6 inches, 8 inches, 10 inches long, or even longer. They can be called what are known as saddle emboli. And what they'll do is they'll dislodge from the wall of the vein. Now, these aren't arteries. These are veins where these blood clots collect. They are connected to the wall of the vein, but at some point they can dislodge. And when they do, they're going straight to the heart. They'll enter the right auricle of the heart, the right ventricle, and they'll go from there right to the lung. So that's how it happens. A clot in the legs ends up in the lung and abruptly occludes a large portion of the lung. In this case, not so large to completely cut off any air supply, but still requiring that the patient be intubated and be placed on a ventilator. Now, what they're doing, the two things. One, they're utilizing Coumadin to make certain that she does not clot anymore, okay?
They're on heparin. Yes, they're on heparin. They have her on.
Excuse me, heparin now, IV, and then she'll be transitioned to Coumadin later on, but heparin for now. And then it's optional as to whether or not they're going to use the big clot buster called TPA. Have you heard anything about TPA being used?
Right.
Okay. So
yeah, but I just heard you can only use it one time.
Yeah, and this may be the one time where it's necessary. Okay, so TPA may be considered at this point if she does poorly with the extreme oxygenation. She is in a critical situation. She's right where she needs to be. The good news is the event itself wasn't life-ending, and so oftentimes it is. So I feel at least very good that she's made it this far. She needs every bit of what conventional medicine has to offer. This is what they're good at. She deserves all the heparin that they can administer her to keep her blood from clotting anymore. And as to whether they use the big gun, the TPA or not, that must be a decision that will be up and coming in the near future.
What about streptokinase?
Another one of the enzymes to help break up clots. Yes, absolutely.
See, she has a growth on her kidney, and they're saying it's coming from the kidney, putting those clots on.
The clots are coming from the kidney.
That's what they're telling.
Well, okay.
She has a growth on the outside of that kidney.
All right, now that they may have focused on the source. The usual source are from the extremities, but any venous structure ultimately dumps into the inferior or superior vena cava. These are the two largest veins in the body. So whether it's a kidney, in this case, that have isolated on, that's very interesting. That's rare. Doesn't usually happen that way. But the mechanism is what the mechanism is. You have taken a clot, it has grown, and it has dislodged from wherever it came from and moved into the heart and directly into the lungs, and abruptly, and I do mean abruptly, altered the ability for you to oxygenate large quantities of blood. That's why the mechanical ventilation, the respirator, and the oxygen is so vital and necessary right now.
Okay.
Hey, I'll keep my fingers crossed for you. First hurdle, she passed, okay?
Okay.
She's got other hurdles, and I'll keep my fingers crossed for you. I'll pray for you this weekend, believe you me.
Okay, thank you.
Yeah, absolutely. Rough, oh boy, goodness gracious. Pulmonary embolisms are really extremely emergent problems, and they're so silent. They just sometimes can give you warning, and that's this famous condition called thrombophlebitis. Varicosities usually are a lead up to that, but thrombophlebitis is when you get veins that actually are infected in the lower extremities, most particularly. And in the case of thrombophlebitis, inactivity, heparinization, as well as using oral blood clotting agents such as Coumadin are also in vogue. Now, I know how my listeners and listeners to this station rile up against these kind of clot busters, especially Coumadin. Oh my God, you all know that that's rat poisoning. It's terrible stuff, but there's a setting for that stuff, and this is one of those settings. And I thank God we have those drugs to use. because in this critical setting they are absolutely necessary. There's no way getting around it. So you're not looking for a way to avoid being placed on heparin and Coumadin. You need that heparin and Coumadin. Now, I do appreciate and actually help frequently in getting people off those drugs on the long term. But on the short term, please understand that all of what conventional medicine has to offer, all of what the drugs are available to help keep this clot situation at bay, they are needed in these critical situations. And so I think you can appreciate that. There's a setting for everything. This is that setting. In the long-term run, 6 months, 8 months from now, when we hope that this patient is up and moving around and back to normal again, then it's another matter altogether as to whether or not something like Coumadin needs to be continued for longer periods of time. But that's another matter. For now, please bear with me on this one. She needs everything that conventional medicine can utilize on her behalf. Anyway, you see how it starts here. Anything on your mind is okay with me. 412-825-6262. That's 412-825-6262. Mention about Dr. Shapiro coming on Monday. Don't miss it. What else? Got an interesting little note, because we talk about Fruit of the Spirit just about every day here. I'm proud to be affiliated with Fruit of the Spirit. This elixir comprised of great tasting 14 biblical fruit purees. We launched it here with the help of Deborah Ray, putting the full force of her reputation behind it. We've had the vice president on our show, I think 3 different times, a gorgeous gal. Her name is Deanna Naylor. She sends me a letter, hoping I'm doing well and things like that. In that letter, she included an unsolicited testimonial from an individual from Joplin, Missouri. Won't necessarily read the entire thing, but it was sort of nice to have this passed on to me. This individual, won't name her, just says, just had to tell you how happy I am to find this product. I'm 78 years old and have suffered with right time leg cramps. I think I'm reading that right. Most of my life, and seem to be getting worse the older I get. The medical doctors offered me no help. I've spent lots of money on health supplements over the years, and nothing helped. My daughter saw your advertisement on TV and ordered some, talking about Fruit of the Spirit, and gave me a bottle at Christmas. My problems seemed to improve in only a few days. I have taken 2 ounces a day for a month now, and I'm so relaxed when I go to bed. I sleep more soundly. That's a couple more phrases. Close it. Comes from a gal in Joplin, Missouri. Glad that Deanna passed it on. We're going to bring Deanna. She wants to come back on the show. We'll bring Deborah on and find out how the product is doing. Deanna wants to talk to you all about how that pricing has changed. Of course, you know how it went down there right at the beginning of the year from a $39 a bottle thing to $29. The way to get it, if you have it and you haven't gotten it and you want to, 2 ways. You can either call this number, 1-800-442-3793, 800-442-3793, or just go, if you're techie inclined, online at fruitspirit.net. That's fruitspirit.net, not fruitofthespirit.net, and a couple of prompts and you'll be up and at 'em again. Let's do this. Let's take a short break, allowing you, of course, to come in and knock on the door at any time. You can do so right now. This is normally a good time for you to do so. I want to tell you a bit about what's going on with this company, Ciara. They just launched countrywide this past weekend, and they have a couple of more chips in their launch that they didn't have before. I want to tell you all about it. Be back in a moment to do just that. See you then.
This is Dennis J. Courtney, MD. Have you become confused about how best to manage your health? It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow
that seems to be reasonable enough, but no matter how dutifully you follow the instructions, it just doesn't quite produce the result that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, M.D. is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Honey, just got the word. The company's new health plan has a $5,000 deductible. We have to make sure nobody gets sick this year. Remember what those doctor's visits cost for last year's cold and flu? Oh, sorry, I gotta go. Love you.
We can do this. We can cut the fast food lunches. Soda, that's a lot of sugar. We could all take that evening walk. And hey, I heard a program about fruit. Fruit of the spirit. What did they say? 1 ounce, the equivalent of 5 servings of fruits with herbs and minerals. We could add some to our breakfast protein shake. Fruit of the spirit is a unique whole fruit puree. Fruit of the spirit contains fresh fruits native to the Holy Land and alkalizing minerals from the Dead Sea with no added sugar. Fruit of the spirit is a unique product from 5 years of work from science-based nutritional experts. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. Fruit of the Spirit, convenient, affordable, and delicious. That's 1-800-442-3793. Call them now, 1-800-442-3793.
Hey, good morning, everybody. Welcome back once again to AM Impact on Your Health. Heard here on KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9. I'm Dr. Dennis Courtney with you on this Friday version of the show. I get them up out of town version of the show 1 week before Easter, and a lot of festivities. A lot of people pulling out of town this week, I notice. My good friends down in Mexico all heading up to Isla de Padre, which is Padre Island. Where the Mexicans own quite a bit of the real estate in this island just off the coast of Brownsville, Texas, and pretty long island. Anyway, it's Semana Santa. Everybody's leaving Mexico and heading for Padre Island. Everybody in Padre Island, well, nobody else is there at Padre Island. They're all waiting for the Mexicans to come up. Many of you are on your way today. My son gets to glom on to one of our relatives and take a trip down to Hilton. A lot of festivities coming up. Stick here with us. We'll be with you throughout the entire week if you will be Pittsburgh bound. And right along with us on the way as we get to Easter for next Sunday. We're here today allowing you to set the agenda. 412-825-6262 is the number to do that. 412-825-6262. Anything on your mind is okay with me. When I hear you knock on the door, I will let you in the store. Now, I wanted to mention this company, Ciara. I know that we were the first to bring you the concept of these transparent holographic chips. It's been now a couple of months. I've been amazed at how well they work. I can really vouch because I've seen so much of the response happening literally in front of me when I place one of these chips onto people. I'm out and lecturing in public. I take the chips with me and I say, okay, anybody that wants chips, step on up here. And usually pretty rapidly I'm able to get a response. So I've been able to vouch personally for how well they work. There have been 3 chips. I told you there's been one for pain problems, not fixing the cause of pain, of that pain in any way. However, able to get you pain relief, even though it's not going to be correcting what caused the pain. Now, that's something you need to be working at between yourself and your doctors. You have to have a pretty good diagnosis already to know that you're not in any situation where you could be harmed by not identifying the source of that pain. But if it's a chronic pain problem, especially if it's musculoskeletal in origin, it is probably unless you do something about it. We would like to help you do something about it, but you also need a way to get pain relief when you're at home, when you're maybe wanting to get to sleep, just like the lady who was talking about thanking Deanna Naylor for her product called Fruit of the Spirit, having terrible leg pains. Pain has been alleviated right in front of me with that chip. The other two chips, of course, one for energy. My goodness gracious, the number one complaint of patients as I see them in my office is lack of energy. And then finally, the ability to assist in getting to sleep. So I have a rest chip, an energy chip, and a pain chip. Well, I had told you that we had launched here in Pittsburgh, all right. We brought this to you in Pittsburgh, that ultimately I think you're going to find these chips found in a lot of doctors' offices that you visit right now. We were happy to be the first to bring it to you, and I said they haven't even launched yet, meaning the company hasn't even launched a product nationwide. Well, now I can tell you, this past weekend in Houston, Texas, they did just that. Ciara launched the product, not just nationwide, they're international too. They got, I was looking at a number of places in Mexico where they have taken the chip to. You'll be hearing more about that as time goes on. But in this launch, they introduced 2 new chips. So now there are 5 chips, not 3, 5 chips. Let's talk about what the other 2 new chips are. The first one they call the EMF chip. I'm reading right off of the literature that was dispensed this past weekend in Houston. The chip counteracts cell phone EMF emissions, and that EMF stands for electromagnetic field, that you've heard about so much. And it fortifies the body's natural resistance. On our product page, assigned to the page, you'll be able to read more and more about that. So now they have an EMF chip. And now the interesting chip. I actually had patients, individuals, they weren't patients of mine, I just met them out in the public, who said, what about a chip for athletic pain? Because, I was using a pain chip, putting it on them, seeing if it helped them. And in some cases, these people were having their affliction because of their athletic prowess. Maybe they're a long-distance runner. Maybe they're getting ready. This is the marathon season coming up. Well, I'll be doggone if the company didn't come up with another chip. It's called the CX2. It's called the CX2 because there's actually 2 chips contained within a packet. One is the professional strength energy chip, significantly improving endurance, mental clarity and focus, stamina, balance, and muscle mass as you work out. So that's one of the chips. The second chip, it's a square chip, and it is to restore circulation and alleviate discomfort that comes with the workouts that some of these individuals are engaged in. They're extremely exhausting and exhilarating, and actually do require some way to recover. Now, I'll be having representatives. I'll bring them here. I'll allow them to tell us what went behind the development of these chips, why they picked these 2 areas, because I'm getting the impression that literally the potential is limitless in terms of how many different chips they could have to alleviate what comes along with a whole host of. I mean, could they have a chip for smokers, let's say, to get off the cigarette habit? I mean, what about obesity? I think the field is endless. However, right now, instead of 3, there are 5. And if you want to order any of these chips, you got to go to the website. The website is www.drcourtney.ciara.com. Now, Dr. Courtney is spelled with D-R-C-O-U-R-T-N-E-Y, no period after that R. That's D-R-C-O-U-R-T-N-E-Y .ciara, C-I-E-A-U-R-A.com. Dr. Courtney, drciara.com. The chips are now available. Even though the launch just happened this past week and the company had geared up and is ready for you, if you want to try any additional chips. I don't have any of the new 2 chips yet, but I'll get them. I'll have them available. And if I see it in public, I guess you can pick from 1 of 5 different things that you want me to chip you for. It's always nice to see when you get a good response. So Company is Upwardly Mobile and launched this past weekend. We've been around here a while. We just didn't launch this past weekend, but we are here with you today on a Friday version of the show. It is called our Get 'em Up Out of Town version of the show. We're letting you set the agenda as you see it and as you want it. 412-825-6262. We'll get you on in here. Why don't we do this? Take another short break. When we come back, let me tell you a little bit about how the eye treatment conference went. Well, why don't we do this? I got a knock on the door right now. Then we'll take a break, and then I'll tell you about the eye treatment conference. Come on in the store. Go right ahead.
Yes, Dr. Courtney.
Yes.
Quick question. Well, two quick questions, I guess. First one is about heart valve degeneration. I just heard recently, even according to studies at Mayo Clinic, that nanobacteria may be the cause of heart valve deterioration.
That's right.
If that is true, how would a person go about finding out if they have this nanobacteria in their system?
Well, the bugs involved, of course, nanobacterium is an interesting bug because you may be mentioning something that you're familiar with, but the other listeners aren't. Let's just say in a quick summation of the nanobacterium, this is supposed to be an organism that literally makes and is the plaque which develops on the lining of arteries. Is that the way you understand it to be?
Well, the comment was just about
the valves.
But the presence of nanobacteria deteriorating heart valves.
Yeah, well, of course, it's deteriorating the lining of the entire cardiovascular tree. There have been a number of different organisms that have been implicated, especially with the valves. I think the number one organism still is not nanobacteria, it is chlamydia, and they certainly do test for that. There is no test that I know of at present to detect the presence of nanobacteria. Certainly no serological testing, and the organism is so small it takes electron microscopy to literally identify it.
But that's what I was asking. I wonder if Dr. Miller's machine could detect that in the blood.
Boy, you know what? Because I think electron microscopy is so, the magnification of it is so much more intense. I'm going to just off the cuff say, and I think Dr. Miller would bear me out. No, I don't think nanobacterium is going to be possible to visualize. Okay, because it's not to the level of electron microscopy. So no, I don't think so. Now, there are, and in fact, there was a company when they first launched that was a way of doing chelation therapy as well as trying to kill nanobacterium by using special antibiotics. Okay, I was never and so I was involved in that study, and it lasted for about 2 or 3 years. I worked it right out of my office. The theory, just like in your case, the theory sounds really interesting, does it not? It certainly grabbed me that there were such organisms, these organisms actually able to colonize within the lining of arteries and along heart valves, and then literally manufacture their own shield around them with plaque, and literally cemented themselves underneath an exterior of protection. Okay.
Biofilms. Okay.
Yeah. So it literally protected itself by being able to manufacture this film. Okay, we'll use the word film over top it, but this film became much more than just some little thin lining. This became a vegetation. This became really problematic. I will say that the antibiotic used at the time was tetracycline. I was never pleased with the results. If there's some antibiotic approach now that works better, I have not yet heard of it. The company that was involved in trying to launch that product, to my understanding, has since gone out of business. But the theory of the nanobacterium was literally launched and developed at that time. That's somewhere about 7 or 8 years ago. So I'm very familiar with the bug. I didn't think the antibiotic approaches worked well then. I'm unaware of any that work well now. Are they a bug that are well known to colonize the lining? Yes, they certainly are. I think there are other bugs like chlamydia titer where we do have tests for those. What I'm going to do, unbeknownst to all of you, I've been in contact with Dr. Jimmy Roberts' office. So you know Dr. Roberts, don't you? The famous
Yes, I've heard.
author of the book Reversing Heart Disease Now. He was the doctor who was literally the lead doctor on that product way back when. That combined chelation with the use of an antibiotic to try to kill Danobacterium. He gave a 2-hour lecture on the thing to me when I first met him. That's how I met Jimmy Roberts. If there's anybody that's going to know the status today of nanobacterium, it's going to be Dr. Roberts. And you can't talk to this guy. I call up the office. They won't let me through. These girls on the switchboard are wearing football pads. They require that I schedule a time to talk to Jimmy Roberts. And I was supposed to connect with him on Wednesday, and we missed. So I get a little phone message that said, "I'm sorry, doctor, you're going to have to reschedule your phone call with Dr. Roberts for another time." And I'm trying to do it. I promised to bring him on the show. I promise you ask some good questions. I know this voice.
If the chlamydia titer is present, how would that be treated?
You could treat chlamydia. You can treat chlamydia with antibiotics. Chlamydia does respond. Okay.
Okay.
I just don't know of any antibiotic in which the nanobacterium responds. And I'm going to be sure that if there is such an antibiotic, and if there's any way of detecting nanobacteria that didn't exist 8 years ago, and there really wasn't, it's just an assumption had to be made, then you just went along with the theory and hoped that you got results. Now, Jimmy claimed he got good results back then, but then he quit using that stuff too. So all in all,
so you need some kind of a material to break down the biofilms first to the nanobacteria.
Yep, you had to rip the shield off. That's where the chelation came in, and then you used the antibiotic. Sound like a good theory? I wasn't really happy with the results. I promise to bring Dr. Roberts to you to explain that a little better, okay?
Okay, one final question about the Joxin. What doctors suggested I take the Joxin because of the atrial fib and the heart valve. What kind of side effects can I expect from that?
Oh, boy. I'll just say this. You're in one of those cases. Digoxin is the standard drug to be used in cases of congestive heart failure and AFib. It is used because you need to have the heart rate slowed down. They usually use 100 as the give and go. You're over 100, aren't you, on your heart rate?
Yeah, it can go from 69 to 120 to...
Yeah. And that's the inotropic agent that's meant to bring down that heart rate to keep it nice and slow. To the extent that it's a tried and true way of doing that, for the moment at least, you need to get the heart rate under control. You've got to be under 100. You cannot allow these even brief times when your heart rate can jump. Hey, I'm betting you it goes higher than 120. I'm telling you, 130, 140, 150 would not be out of the realm of the possibility.
Yeah, I've tried Metropolol, the other...
I know.
I've had bad side effects from those.
Well, not only are they pushing for you to use DIG, they're pushing for you to use Coumadin, aren't they?
That was suggested, and I was suggesting, how about magnesium, potassium, calcium?
They love talking to you. Now, I think that if you can slow the heart rate down, the DIG has to be considered because you are in an emergent situation with heart rates above 100, especially as high as they can get. With respect to the Coumadin, that's an entirely different matter. You need to make certain that your rate stays under 100. Hey, if you can get that in the low 90s and 80s where it should be, all the better. But the Coumadin, I do believe there are other ways to work around that because they're worried about you developing a clot. And the clot has some pretty serious consequences you don't want to confront. You got to have a system in play to compensate for not being on a Coumadin. They won't go along with anything, but we'll work with you on that one. Please come on and see us, all right?
All right, thank you very much.
All right.
Bye-bye.
Let's do this. I know I get a caller out there. Why don't we just hang on, caller? Don't go away. Going to come back here in about a minute. Going to take a short break. As soon as we return, I'm going to get to that caller who isn't going to go away. All other callers, 412-825-6262. That's 412-825-6262. We will be back in a moment.
Have you visit a doctor lately? Was fatigue top of your complaint list? Even if your doctor asks you what you need, the recommended 5 servings of fruits and vegetables a day is a dream in your busy schedule. What if you learned of a product 5 years in the formulation that delivers 5 servings of fruits and minerals in just 1 ounce? That's right, it's Fruit the Spirit. The blessings of Fruit the Spirit are now formulated into a delicious whole fruit puree product rich in antioxidants and minerals. Your health is more than just a test result. It's a balance of physical, spiritual, and emotional factors. You work regularly to strengthen your faith. Let Fruit the Spirit help cover your nutritional needs in a convenient and cost-effective ounce a day. Call 1-800-442-3793 for a special promotional offer. Fruit the Spirit, a blessing to your good health. Fruit of the Spirit, 5 servings of fruits and minerals with no added sugars. That's 1-800-442-3793 for your good health. Call them now, 1-800-442-3793.
This is Dennis J. Courtney, M.D. You become confused about how best to manage your health. It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instructions, it just doesn't quite produce the results that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, M.D. is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Good morning and welcome back, everybody. This is Dr. Dennis Courtney with you on a Friday version of this show we call AM Impact on Your Health. Really enjoy doing this show with you each and every Monday, Wednesday, and Friday from 8 to 9. On this Friday version of the show, we've opened it up to you. We said, hey, look, anything on your mind is okay with me. 412-825-6262 will get you on in here. We did have a knock on the door just before we took a break. Hope you're still there. Come on here and say what's on your mind. Hello.
Good morning, Dr. Courtney.
Hi.
I heard you talking to the last caller and how the heart rate had to be under 100, 120.
Yeah, 100, not 120.
Yeah, I understand that he had a condition and that's why, but what about whenever, you're doing like an exercise? Or,
No. Hey, your heart, when you're exercising, that heart rate's going up. In fact, many exercise regimes, I can tell in my old physical education background, which I proudly entered into the profession, the teaching profession with, I mean, there are kinds of training that actually take you to max heart rate, which maximum heart rate is around 150 in everybody. So whether you're the poorest athlete going or one of the best athletes going, your max heart rate is around 150. What determines how healthy you really are is how quickly can you return to normal. So the person who's out of shape, the person who doesn't have a good athletic prowess, they'll get up to 150. By the way, they may stay there for a half hour, okay, before they can return to some level of normalcy back up below 100. Those who make it to 150, however, pathologically, as the gentleman was saying before, as he was doing, he didn't mention 150. I believe he probably could get the level to 150. It's dangerous medically for him. It isn't dangerous medically for you to exercise, get yourself to a max heart rate of 150. Interestingly, take your pulse and see how quickly you can return. The quicker you return to normal levels, the more you're well-conditioned your cardiovascular system is. So you shouldn't worry about levels of over 100, 120, or anything like that. You won't be able to get over 150 no matter how hard you try.
Right.
But you're still efficient at that level.
So working out 3-5 times a week and getting your heart rate up to 100, 120 or so, it's not really considered a bad thing.
Oh no, that's cardiovascular endurance. That's one of the best ways of getting in shape because it bursts open the capillary beds in the lungs alveolar sacs enlarge in the lungs. You're able to develop a network of blood vessels and vasculature in all the organs. It is the best way to do it in terms of what exercise is all about. Now, in the case of the gentleman who called, he could be sitting in a chair watching Jay Leno, and in one moment he can have a heart rate of 60. In the next moment, without any provocation, his heart could jump up to 130, 140.
Okay.
That's a problem. You can't see.
So how fast, how do you look at, like, if you have it up to 120 and they bring it back down to like 70? And what time frame are you looking at?
Now I think we're getting into exercise physiology. I can tell you what, all my students I used to teach in the high school, we did a test where we worked them out for 6 minutes, had them just like step up on their seat of their desk for 6 minutes. Everybody's heart rate, and they were sophomores in high school, everybody's heart rate approached 150 without a problem after 6 minutes, okay? So you keep saying 120. If the highest your heart rate ever gets is 120, with a vigorous workout, you're in pretty good shape already. I can tell you that, because I'd expect you to get to 150. But how rapidly you return to a normal level of, we're going to say, 80 to 90, that's what the changes between individual and individual. And I couldn't tell you, I mean, there are books you can get on the internet. You could find heart rate interval training. I think that's the category. And they'll have a scale that you can look at. Right off the top of my head, I can't tell you how quickly and at what level of return to normal you could gauge yourself as being in great shape versus someone who wasn't. But that information is freely available. Check it out or call any of these gyms that have a personal trainer. And those personal trainers are familiar with those grids, and they'd be able to tell you almost in a heartbeat what would be considered a good rate to return to normal. Okay?
Okay, thank you very much. I appreciate it.
You're so welcome.
Thanks.
Hey, making me pull upon the path. Yes, but that is a tried and true way of utilizing your body's own personal dynamic and tailor-making a program for you, especially with the assistance of a personal trainer. We're here today allowing you to come on in the store and set the agenda. Anything on your mind is okay with me. 412-825-6262. We'll get you on in here. 412-825-6262. Be waiting to hear a knock on the door. I wanted to mention we made such a fuss, and we always do, with respect to Dr. Edward Kondrak coming to town. Now, the Pittsburgh boy, ophthalmologist, his office was in Mount Lebanon, and he was here in Pittsburgh for many, many years. You know, we lost him. He went out to Phoenix, but he comes to Pittsburgh. This now was his third time this year, and he's going to be here a fourth time because he's coming back in June. And what he does, and what I spent last evening with him as they readied to leave town, is that he really does enjoy these 3-day, 4-day treatment seminars as a way to actually mold his practice. So when he goes back to Phoenix, he literally is going to, he's purchased a big ranch back in Phoenix, 250 acres, which I don't know what the land laws are out there, but evidently the way it's constructed and in such wide open spaces that he is given the rights to use, it's 250 acres, he's given the rights to use 280,000 acres. I'm right about that number. And he actually could put cattle on that land and treat it as his own for up to 10 years. And this is something that's evaluated. I never heard of such a thing, but it's the way it is out in the West. Anyway, he's going to have his own little wellness area out there at a ranch. It's just beautiful. I'll bring him on the radio show when he gets more formalized, where they showed me all these pictures. The point I want to mention is what has happened with respect to the patients that participated in this particular one, because I have been more involved with this group of 8. There were a group of 8 individuals, all with varying eye disorders and various degrees of visual disturbances, who participated in this 3-day to 4-day treatment seminar. And I had another interesting glimpse at this, another different perspective that I never had before, is my oldest son, Joe, 22-year-old guy, who helps me a lot around my own office. He was recruited by Dr. Condrat and his staff to be an assistant for him out there at the Marriott Airport. Now, all the patients love Joe. He's just that kind of a guy, big, burly, cuddly kind of guy, just so mild, a meek individual. I can't say enough about him, but of course, as a proud parent, it's time for me to stop. But what it was interesting to me is my son would come back and say, "Dad, I can't believe what's going on out there." He goes, "I don't understand it, but these people in a day or two are having an improvement of their acuity by 1 and 2 lines on the eye chart." And I said, "What?" He goes, "Yeah, like they're doing, they were doing the IVs and they were doing this microcurrent stimulation, the same things that Dr. Condrat mentioned on our radio shows that he would be doing, and that really are part of the treatment program. I've known about this for years. What I have never known is the rapidity with which these people are responding." And so with the 3 big eye disorders that I'm sure these 8, now I don't know what particular eye disorders any of the 8 or all the 8 or some of the 8 may have, but I know that on one of the 3 categories, it's either macular degeneration, or it's cataract formation, or it's glaucoma. One of the 3, because these are the 3 biggies. Anyway, literally to the person, if I understood my son correctly, and when I was with Dr. Condrat and the staff last night, they reiterated, "Oh yeah," they looked at me like I was a stranger from another planet, saying, "What do you mean? We see these kind of results all the time." So what I say to you all, if you're one of the 8 that I happen to meet, and because I spent some additional time, not just at the lecture on Sunday, as I always have done, but I went back out, and I was sitting around in a sort of a room where they were having a big discussion with Dr. Ed on Tuesday afternoon. But to the person, all these folks have advanced. Like if they were seeing 20/50, they could be seeing 20/30. They improved 2 lines worth of acuity in 2 days. Simply amazing. Had to pass it on to you. Found out and had it verified last evening that, hey, this happens all the time. This is not unique. This is what we do. Needed to pass that on to you folks. If you're having trouble with visual problems, and I've always said, you're a little sick and tired of your conventional ophthalmologist and the fact that you're not getting improvements, I just had to say that with those kind of improvements, and my son bringing this to my attention, they never did with Dr. Ed Condrat's staff, but have it verified by the staff, says, hey, look, get ready for his return. He's already got a couple signed up for coming back in June. We're going to be involved with him again. We've turned out to be his doctor in absentia. We'll be able to continue many of, especially the IV things that they initiated with these 8 patients, and with previous groups here in our office. We're pleased to be associated with Dr. Condrat in that way. So we're going to act as his Pittsburgh liaison to help maintain the very good results that they started, and hopefully, who knows where they're going to go with this by the time Dr. Condrat returns, and we're rechecking their progress. So that's the way it is out there in the visual world with these alternative treatments. Unbelievable. We'll talk to Ed. I said, hey, Dr. Ed, we'll be probably recontacting you in the month of May to get you all ready and get Pittsburgh ready for your return. So expect that we'll have another conversation with Dr. Ed at that time. All right. Enough of that. Let's take a short break. When we return, if there's anything on your mind at all as we come around that gun lap It's okay with me. 412-825-6262. We'll get you on in here in the gun lap version of the show. Be right back.
This is Dennis J. Courtney, MD. You become confused about how best to manage your health. It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instructions, it just doesn't quite produce the result that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Honey, just got the word. The company's new health plan.
Mark Courtney,
Oh, yeah.
there's one call now waiting for you. One call, and I won't beat you for that one call.
Thank you, Barry.
Sorry. I've got to go. Love you.
We can do this. We can cut the fast food lunches. Soda, that's a lot of sugar. We could all take that evening walk. And hey, I heard a program about fruit of the spirit. What did they say? 1 ounce, the equivalent of 5 servings of fruit with herbs and minerals. We could add some to our breakfast protein shake. Fruit of the Spirit's unique whole fruit puree. Fruit of the Spirit contains fresh fruits native to the Holy Land and alkalizing minerals from the Dead Sea with no added sugars. Fruit of the Spirit's unique product from 5 years of work from science-based nutritional experts. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. Fruit of the Spirit, convenient, affordable, and delicious. That's 1-800-442-3793. Call them now. 1-800-442-3793.
Good morning, everybody. Welcome back once again to AM Impact on Your Health here on this Friday version of the show, a get 'em up out of town version of the show, and literally in this week preceding Easter, get 'em up out of town is happening. Just had my 18-year-old son stop in the office so he could get on his way, as many are doing for his little break here, spring break. It's like a rite of passage for 18-year-olds anymore. It drives me crazy when I see this happening. And my 11 and 12-year-old saying, when do I get a Easter break? So, a little bit of a problem. You who remain behind with me, hey, it's okay. I'm going to be here with you too. 412-825-6262. We'll let you and I communicate all throughout the entire week and even the rest of today. In the interim, we did have a caller call up to put their 2 cents in. Come on in the store. Hello and welcome aboard.
Good morning, Dr. Courtney.
Hi.
I want to ask a question about someone, an elderly man who has a chronic bladder infection.
All right.
And they have him on Flurmax, and they've tried Aspirin and a few other products.
Sure.
But it keeps reoccurring. Is there any other suggestions you could make to help?
Well, let me say this much. Frequent UTIs, urinary tract infections, of which bladder certainly is part of the anatomical apparatus to be included in UTI. UTIs in women, really common. UTIs in men, really rare. So that's the first point I want to make. For him to have, you say, frequent urinary tract infections, frequent bladder infections, did I hear you correctly?
Yes.
Okay. There has to be an anatomical obstruction here to the flow and the outlet for urine discharge. In women, the reason for the frequency, and I don't know if you'll put yourselves in that crowd, but the women out there, you know who you are. And many women have been plagued with a lifetime worth of urinary tract infections. And the reason is the urethra is so short that there, unfortunately, is too easy an access between bacterial and other microbial and contaminants that can move from the outside, only travel a short distance up into the bladder, and create these raging infections. That's what's common in women, and it's the reason why it's so rare in men, because the length of the urethra passing through the penile shaft is so much longer that we don't expect to find any urinary tract infections in men at all. Whenever a man shows up with one, it literally is like time to call the press. I say that with tongue in cheek because this is not supposed to happen. When it does happen, well, when it happens once, we all cast a glancing eye. But if it's repetitive, there is an anatomical obstruction that has to be relieved. I'm guessing that he's not being treated just by his primary care doctor. He has a urologist in his repertoire right now, doesn't he?
He has one, but because of his limitations, he doesn't go to the urologist. It just is like it's the last year he's had like 3-4 infections.
Okay, well, based on his age, because I'm getting the impression he's an elderly guy, right?
Yes.
So right off the bat, a very common outlet obstruction in elderly males, and not so elderly, by the way, is hypertrophy of the prostate gland. And so that can certainly shut off the flow of urine and allow for an infectious material to be retained in the bladder. So right off the top of my head, I'm not even worried about a special anatomical problem that would be unique just to this gentleman. A common anatomical problem in all men is the hypertrophy of the gland, of the prostate gland, which restricts outlet of the flow of urine from the bladder outside. I have to say, though, there is absolutely got to be an anatomical obstruction, and that has to be relieved in order to get this particular problem to cease and never be a problem again. Got to work on the obstruction component, okay?
Well, how do they do that?
Oh, they'll do a cystoscope and look right up into the bladder, okay?
Okay. Thank you very much.
Absolutely. The bongos have sounded. It's time to get on out of here. Look, folks, have a wonderful weekend. I'm hoping it's okay. I thought we were going to float away last night. Till Monday, we're going to be back with Dr. Eric Shapira, and looking forward to that discussion about issues of aging. Until then, this is Dr. Dennis Courtney saying so long for AM Impact on Your Health.